Hi everyone. Today we are so happy to meet with Dr. Yuan and Dr. Orr, who are authors of the article Essential Reading for Cephalalgia, Editor's Recognition Choice of the Month. And we're going to talk about neuromodulation in headache medicine. So congratulations, and please, Dr. Ioanna's first author, tells a little bit about yourself, where you joining us from.
Good morning, everyone. Thanks so much for the invitation, and thanks Dr. Sacco for choosing this article for the essential read of the month. And again, this articles cannot be done with our whole team. Dr. Orr here, we had a lot of discussions to make this happen. I'm currently associated with the Jefferson Headache Center, so in Philadelphia. And I'm really glad to be invited here to share some of our thoughts on this paper. Thank you.
Thank you so much. And Dr. Serena Orr, thank you so much for joining us all the way from Canada. Please tell us a little bit about yourself.
Thank you so much for inviting me. It's a pleasure to talk about this work. That was great collaboration. I'm a pediatric neurologist and clinician scientist and associate professor at the University of Calgary in Calgary, Alberta, Canada. And I do a lot of systematic reviews and methodological assistance. So I'm happy to be here to talk about this important collaborative project.
Thank you so much. It looks like amazing amount of work was done to do that. What brought you to that? Could you tell us a little bit about background?
Yes, thank you. So this study was originated a few years ago when Dr. Silberstein had a thought on creating a guideline paper. It's not just the evidence review is more focusing on the practical guideline because there are so many devices approved by the FDA or is cleared by the CE. And so we want to have a statement here. And then that's one of the reasons we focus on the actual devices, not the modalities. So we review the existing devices, all the FDA-approved one or CE marked ones, and then we gather their evidence. And not just that, we also create recommendations on top of that. And this is all started probably 4 or 5 years ago. And it took us quite a while to finish this. A lot of work behind it, a lot of teamwork, junior members, senior member, so many discussions and multiple meetings. So we're really grateful for all the members who contributed this piece.
Thank you so much for doing it. We definitely need more information about neuromodulation devices. What were the methods of your research and work?
So we started this work with a systematic review and we searched the literature from inception on the CE marked and FDA cleared devices that we can discuss after. And then we used standard systematic review methodology. We had a librarian develop the search, peer review it, and then we went through 2 stages of screening that were completed independently by 2 different people. And then after that, we treated the evidence in 2 different ways. So we had the highest level evidence from the randomized controlled trials, went through a quality appraisal using Cochrane methods called a ROB2 tool. And then we used the grade methodology in order to come up with recommendations based on the quality of the evidence and the data synthesis. There were meta-analyses that were done as well so that we could estimate the effect size of the interventions. But we wanted to make these guidelines practical beyond what we could comment on based on the highest level of RCT data. So we also used other studies that didn't meet the bar for grade to comment on things like pediatric use in pregnancy, use in menstrual migraine, so that we could start to have some expert consensus based on lower quality evidence for uses outside of the clinical trials and the way they were studied.
Thank you so much. And what were the sum of results and conclusions?
Yes, so we we have, so in this practical guideline paper, we have evidence-based recommendations. We also have experts' opinion-based suggestions. And for the recommendations, we separate into acute migraine attack and preventive migraine management. So we have conditional recommendation for 4 FDA-cleared devices. They are Sabi Duo, Cephalalgia, Relivion, and Nerivio. And for preventive, we also conditionally recommend Gamma Core Sapphire, Cephalalgia, and Nerivio. Then we also have expert opinion-based suggestions. That's very long. We welcome the readers to read the actual tables. Yeah.
Thank you so much. Yes, it's amazing work already done. And what do you see in the future?
Yeah, I think neuromodulation, in my opinion, has a large place in the management of migraine clinically, in particular in situations when the patients prefer to use neuromodulation. For example, we did a pediatric study where we asked families and children and adolescents if they were not responding to pill-based acute interventions, what would they want as a next modality? And neuromodulation was their next choice after pill-based interventions are ineffective. So there's a significant amount of patients and families that prefer to try neuromodulation or, non-pharmacological strategies for a variety of reasons. And so I think it's important to keep studying them. There's also populations where neuromodulation may be deemed safer, like in pregnancy and in youth. And so my hope is that the literature can expand to some of the questions that we've tried to address in a preliminary way in the expert consensus part, and do clinical trials in populations that haven't been studied yet, such as pediatrics, pregnant, menstrual migraine. I mean, not studied yet in, randomized controlled clinical trials.
Thank you so much. Yes, Dr.
And
Yuan.
also, that is a very important clinical aspects of the future for the future. And I also want to point out some regulatory and study design kind of issues. We spend some paragraphs in the discussion talk about the regulatory and access challenges. Many of these devices, even they're FDA cleared or CE mark, they don't always translate to insurance coverage. So we want to somehow encourage more of this is a major barrier into recommendation. That's the reason we really hope that this article can help some of the devices get some insurance coverage. But with that said, there are also some study design issues. So we talked about most of the trials. Actually, they originated before the publication of the 2021 controlled trial guideline for the neuromodulation devices. So we advocate for the future use of adherence to these guidelines so we can have a better studies for generating higher quality of evidence for the future.
Thank you so much. And thank you for bringing up not only clinical aspects, but also future research and advocacy for our patients and our profession. So I hope we see more of your work in cephalalgia and cephalalgia reports. And congratulations again. Thank you so much.
Thank you for inviting us.
Thank you. It's a pleasure.